Hi everyone, my name is Tyler Bisbee with Cal Baptist University. This is Kinesiology 353. Today I'll have my son Aiden volunteering with me, and we'll be talking about 3 injuries that are pretty common in high school football. And for each one of those injuries, we'll be looking at a pre-rehabilitation or a rehabilitation exercise that we can conduct to help strengthen our athlete. All right, so our first injury is going to be the cervical spine strain. And this is going to be an injury to the muscle or tendon that runs along the backside of our neck. These are common in high school football, especially in kids who drop their head during tackling or come down and get hit by another athlete with head-to-head contact. So with the cervical strain, we have a lot of muscles that are going on in the back of our necks here. Primarily the semispinalis capitis, the splenius capitis, and the levator scapulae muscles coming up into the neck. These are our common strains, and it's important to make sure that after we have an injury to the neck, we start to rehabilitate the neck so that we can get range of motion and strength back and have our players get back into the game. All right, so with my patient with this cervical strain, I want to have them start with exercises that are going to improve strength and range of motion, especially range of motion. And none of these exercises should be done to a point where they're in a lot of pain. It should be very minimal pain. They should only be moving their heads to the side until they start to feel slight pressure. So what I'm going to do is I'm going to have my patient use the opposite arm to the side affected, and then they're going to go ahead and move their head sideways to stretch that muscle out, and they're only going to go as far as they feel comfortable. Once they get to that comfortable spot, they're going to hold that stretch for 8 to 12 seconds. We'll repeat this 2 to 3 times, and we'll do this 2 times a day until this pain starts to feel better and we get full range of motion back. And then what we'll do is we're going to go ahead and go back to our neutral position, and then we'll use our other arm, and then we'll go the opposite way to the point of comfort, and they're going to hold that stretch 8 to 12 seconds. We'll do these 2 to 3 times, and we'll do this 2 times a day until the pain starts to feel better and we get full range of motion. All right, so we're looking for progression in our patients with cervical strains, and what this will do is we'll include rehabilitation that's going to help stretch these muscles out. The patient may want to follow up with a chiropractor, have their neck adjusted, be seen by a primary physician. But in most cases, when we start to reach full range of motion and no pain in the neck, the student, the patient, the athlete, they should be able to move back into their sport. In this case, the high school football. All right, so here my player has a ACL tear, or an anterior cruciate ligament tear. And basically what's going on is we have the anterior cruciate ligament that runs just behind the kneecap here, the patella, and it's going to be connected to the femoral epicondyle and coming forward into the lateral side of the tibial spine on the fossa on the proximal end of the tibia. And when we have a student, an athlete, or a patient that's been out playing high school football, they've been moving using their jump cuts or their quick cuts, or even pivots, there's a good chance that we'll have an injury to this ACL if we're not careful. So with this ACL tear, it's important that before surgery and right after or immediately after we have the injury to the ACL, we use our acronym RICE in order to help treat this and prepare the patient or the athlete for surgery or leading up to surgery. And it's also going to help with the rehabilitation and the healing process. All right, so with my athlete with an ACL tear, it's important that we use the acronym RICE. Rest, ice, compression, elevation. The most important thing is making sure that our patient gets plenty of rest. With plenty of rest, they're going to help with their healing process and with rehabilitation after surgery. It's also important that while they're resting and when they get up, they also use ice on the injured site. We'll be using just a bag of ice, and we'll always want to use something to cover up and not have direct ice contact with the skin. And we'll be icing that for 20 minutes every 2 hours. And we'll be doing that each day up until surgery. So along with our icing, we should also be applying a compression bandage or an elastic wrap to help with the compression on the injured or affected site. So in this case, I'm going to go ahead and apply a figure 8 style compression wrap to that knee, making sure that I'm not applying it too tight. I always want to make sure that I'm checking pulse motor sensory and capillary refill when I'm checking my patient's leg to make sure that I'm not cutting off circulation, and that should be done before and after the application of any kind of wrap like this. And then from there I can go ahead and apply my ice and then make sure that my patient's keeping their leg elevated throughout the day to help promote good rehabilitation and good healing for the affected injured zone. So with a patient with an anterior cruciate ligament injury, especially post-surgery from an ACL tear, we're going to be using rehabilitation for range of motion and strengthening of that knee and of that ligament. Good exercise for that is the stationary bike. Unfortunately, at the house, we don't have a stationary bike, so what we're going to do is simulate the stationary bike with my son, Aiden. And what we're going to do is just on his cue, we're going to be using that range of motion, that circular movement with the feet. Go ahead and start pedaling slow. And what we're doing is we're working on strengthening up that ACL, nice and slow. We'll be doing this from 10 to 20 minutes each set, and these sets will last for 2 times a day. And so after we have those 2 times a day, we'll be doing this each day until we have a primary doctor or an orthopedic doctor tell us to stop. And there is no amount of bicycling that's going to be bad for our patient. All right, so with our progression with an ACL tear, post-surgery we're going to be working rehabilitation. It's important that we work on range of motion and slowly strengthening that leg. In this case, we use the stationary bike. There are many exercises that we can use to help strengthen the leg and the ACL in itself. And we're going to continue to work on that and follow up with our primary care physician to make sure that the ACL is healing properly, and we should be able to get back to sports after our physician releases us, or after so many weeks that we're able to get back our full range of motion and our strength back in our leg with limited to no pain. So for our last injury, we have a fractured ankle. Also, most common being the bimalleolar fractures. And what's happening is we have a break in both our tibia over on this side, on our medial side, and we have a break to the fibula on the lateral side. Malleolus is being at the most distal end of the fibula and the tibia. So with bimalleolar fractures, it's common for these fractures to be displaced or unstable. But we also have fractures that are stable, so depending on the severity will determine whether the patient has surgery or no surgery, and whether they're going to have a boot put on or a cast, and that's going to affect how we rehabilitate the injury. So like our ACL tear, it's also important that we utilize the RICE acronym. We want to make sure that our patient has plenty of rest so that they can utilize the healing process and let their body start to recover from a break to the ankle. It's also important that we ice to either side for 20 minutes every 2 hours. It's important that we keep the leg compressed and elevated. So we'll use an elastic wrap, an ACE wrap, depending on our physician's guidance. Because after a break there is a lot of swelling, we may need to wait on that elastic wrap. It's also important that our patient keeps the leg elevated, and we can do so by adding pillows underneath the leg so that they can rest and keep their foot elevated. And then they can continue to ice that on and off, 20 minutes on, every 2 hours. All right, so with our patients with a bimalleolar fracture or an ankle fracture, it's important that we start to rehabilitate once we can start putting weight back onto that foot from guidance from our primary care physician or the orthopedic doctor. And what we're going to do for rehabilitation is we're going to start with heel raises. And all we're doing is we're going to have our patient stand. They can hold on to a chair here, and what they're going to do is they're going to plantar flex and hold for 6 seconds and then slowly let themselves back down. And they're going to do this, 8 to 12 times, with the sets being 2 to 3 times, and they'll be doing this 2 to 3 times a day. And we'll be doing this over a course of weeks until our primary care doctor says that we're able to start really weight bearing and finishing up our rehabilitation. So our progression should always be working towards range of motion and strength. With our heel raises, what we're doing is we're building up our range of motion. We're also building up strength. And for our patient, we can also start them increasing their range of motion. They may not be able to get a full plantar flexion at the degrees that they need, so they're going to be working to make sure that they get full lengthening, full range of motion. They can also start to hold these heel raises longer, and we can also start to set up more sets during the day, and we'll work into other exercises that will help with our strength training. So I just want to say thank you everyone for watching this video, and if you have any questions or concerns, please reach out to me, and I really appreciate your time.